I'm Dr. Emily Carter, a board-certified urologist with over 12 years in clinical practice, and I need to tell you something before we go any further. Almost everything circulating online about daily sexual activity after 50 is incomplete. Some of it is dangerously wrong. Today, I want to give you what the clinical evidence actually says, not what a wellness blog told you, not what your gym buddy swears by, but what peer-reviewed research and a decade of clinical practice actually show. Drop a comment right now and tell me what you've heard about this. I genuinely want to know what's circulating, because what I hear from my patients tells me the misinformation on this topic is running rampant. Here's what most men over 50 have been told. Daily sex or daily ejaculation after 50 will drain your testosterone, exhaust your body, and accelerate decline. I've had men sit in my office, men in their 60s and 70s, who've essentially put themselves on a kind of involuntary celibacy because someone told them they needed to conserve their energy. On the other side, there are men who've read somewhere that daily sexual activity will flood them with testosterone and reverse aging. Both of these positions are wrong. Here's what the evidence actually shows. Let's start with the biological reality. What actually happens to a man's body when he engages in sexual activity every day after 50? The first thing to understand is the hormonal response, and this is where the most popular myth collapses. The myth says ejaculation depletes testosterone. Here's what the research actually found. A study out of Zhejiang University in China, tracking 28 healthy men over a period of 7 days, found that abstaining from ejaculation for 7 days led to a temporary spike in testosterone, roughly 45% above baseline on day 7, followed by a return to normal levels. What does this mean clinically? It means that abstinence creates a short-term, time-limited hormonal fluctuation. It is not storing testosterone. It is not building a reserve. The body is not a battery. Testosterone is produced continuously by the Leydig cells in the testes, regulated by luteinizing hormone from the pituitary gland. The mechanism is straightforward. Ejaculation frequency within a normal range does not chronically suppress testosterone production in men over 50. The clinical evidence simply does not support the depletion narrative. Now, there is a nuance here that I want to be precise about, because precision matters. Testosterone levels in men over 50 are already declining, roughly 1 to 2% per year after age 40, according to data from the Massachusetts Male Aging Study, which tracked over 1,700 men over a period of more than a decade. What this means is that your baseline is lower than it was at 35. Daily sexual activity does not accelerate that decline, but it also does not reverse it. Men who expect daily activity to function as testosterone replacement therapy are working with the wrong framework entirely. What daily sexual activity does affect, meaningfully and measurably, is cardiovascular function. And here's where the news is genuinely good and genuinely grounded in evidence. A study published in the American Journal of Cardiology, following approximately 1,000 men over a 16-year period, found that men who had sexual activity twice weekly or more had a significantly lower risk of cardiovascular events compared to men who had sexual activity once a month or less. The mechanism is not mysterious. Sexual activity elevates heart rate, increases blood flow, and engages the vascular system in a way that is physiologically comparable to moderate aerobic exercise. For men over 50, whose cardiovascular risk increases with age, this is a clinically relevant finding. The clinical evidence shows that regular sexual activity supports vascular health in aging men, not as a substitute for cardiovascular exercise, but as a meaningful complement to it. The second biological layer is prostate health, and this is where the data gets particularly interesting and where a lot of men have been given incomplete information. A study published in European Urology, following over 31,000 men enrolled in the Health Professionals Follow-up Study across an 18-year period, found that men who ejaculated 21 or more times per month had a 33% lower risk of prostate cancer compared to men who ejaculated 4 to 7 times per month. This was not a small sample. This was not a short study. The researchers controlled for diet, weight, smoking status, and other confounders. The proposed mechanism involves regular flushing of the prostate ducts, reducing the accumulation of potentially carcinogenic secretions. That's a myth that needs to die permanently. The idea that frequent ejaculation stresses the prostate. The clinical reality is the opposite. Regular ejaculation appears to be protective. Now, this is where the emotional dimension of this conversation becomes important, because I have sat across from men who have been genuinely ashamed of their sexual appetite in their 60s and 70s. They've absorbed a cultural message that desire at their age is somehow inappropriate, or that their body is sending them warning signals when what it's actually doing is functioning normally. I had a patient, 68 years old, retired engineer, came in for a routine checkup, who mentioned almost in passing that he and his wife were still sexually active several times a week. Then he lowered his voice and asked me if that was too much. He had no symptoms. His prostate markers were excellent. His cardiovascular indicators were strong. He had internalized a cultural narrative that had no clinical basis. I showed him the data. I watched the tension leave his shoulders. That is what evidence does. It replaces shame with information. The emotional picture becomes more complex, however, when we examine the neurochemical dimension. Sexual activity triggers the release of oxytocin, dopamine, and endorphins. In men over 50 who face statistically elevated rates of depression and social isolation, data from the American Journal of Geriatric Psychiatry shows that nearly 15% of men over 65 meet criteria for clinical depression. The role of physical intimacy as a neurochemical buffer is genuinely significant. Oxytocin, in particular, has been associated with reduced cortisol levels. Chronically elevated cortisol is one of the mechanisms through which chronic stress suppresses testosterone and impairs immune function. The clinical evidence shows that regular sexual activity, in the context of a stable relationship or healthy solo practice, supports psychological well-being in aging men, not as a mood enhancer in the superficial sense, but through measurable neurochemical pathways. Now let's address the practical dimension. What actually changes physiologically when a man over 50 attempts daily sexual activity, and what the evidence says about sustainability? First, erectile function. Daily sexual activity for men over 50 requires adequate erectile function, and this is where individual variation becomes critical. Erectile dysfunction affects approximately 52% of men between 40 and 70. That's data from the Massachusetts male aging study I referenced earlier. The causes are predominantly vascular. Atherosclerosis, hypertension, and diabetes are the primary drivers. Interestingly, regular sexual activity, by maintaining vascular engagement and nitric oxide bioavailability, may actually support erectile function over time. A study published in the American Journal of Medicine, following 989 men over a 5-year period, found that men who had sexual intercourse less than once weekly were twice as likely to develop erectile dysfunction as men who had intercourse weekly or more. The mechanism. The penis requires regular oxygenation through erections to maintain healthy tissue. That's the clinical reality. Use it or lose it is not a folk saying. It is a vascular principle. Second, libido and testosterone interaction. Daily activity in men with low testosterone may result in reduced libido over time, not because activity depletes testosterone, but because low testosterone was already present. If you find that your desire is decreasing, the clinical correct response is a full hormonal panel, not abstinence. The clinical evidence shows that libido issues in men over 50 are almost always hormonal or psychological in origin, and almost never caused by frequency of activity itself. Third, physical recovery. Here's what's wrong with the depletion narrative in a very practical sense. Semen production replenishes rapidly. The testes produce approximately 1,500 sperm per second in healthy men, and seminal fluid is replenished within 24 to 36 hours. The idea that daily ejaculation leaves a man physically depleted is not supported by the data. Fatigue following sexual activity is real. It involves the release of prolactin and serotonin, which have temporarily sedating effects. But this is transient. It resolves within hours. It is not cumulative physiological depletion. Here is your evidence-based action plan, each step grounded in what the research supports. 1. Maintain regular sexual activity at a frequency that feels natural to you. The research does not identify a single optimal frequency, but the protective effects on prostate health and cardiovascular function appear at frequencies of 2 or more times per week. Daily activity, if sustainable and desired, is supported by the evidence. 2. If you notice declining libido or erectile difficulty, get a full hormonal panel: testosterone, free testosterone, SHBG, LH, FSH, and prolactin. Do not self-diagnose. Do not self-treat. Get the data first. 3. Support vascular health through the established mechanisms: regular cardiovascular exercise, blood pressure management, and dietary choices that support nitric oxide production, including leafy greens and foods high in L-arginine. Sexual health and cardiovascular health share the same biological infrastructure. 4. If you are solo in your sexual practice, understand that the clinical evidence treats masturbation and partnered sex equivalently in terms of prostate and cardiovascular benefit. There is no clinical distinction. The ejaculatory mechanism is the same. 5. Remove shame from this conversation. If you are in a relationship, have the honest conversation with your partner about what frequency feels right for both of you. Sexual desire in your 60s and 70s is normal. It is healthy. It is clinically documented. Gentlemen, if you've been holding back out of shame, out of fear, out of misinformation, I want you to hear this clearly. You haven't been protecting yourself. You've been working with an incomplete picture. Now you have the full clinical picture. The evidence does not support restriction. It supports engagement. Thoughtful, sustainable, health-informed engagement. Tell me one thing you believed about this topic that this video changed. I read every comment and I respond to as many as I can. It helps me understand what men in your position are actually being told, and it helps me make better videos for you. I'm Dr. Emily Carter. The clinical evidence is clear. Regular sexual activity after 50 is not a drain on your health. For most men, it is a measurable contributor to cardiovascular function, prostate health, and psychological well-being. Take care of yourself, and I'll see you in the next one.